Living with arthritis can be tough, but avoiding certain foods can make a big difference in managing the symptoms. In this video, we'll highlight the top foods to steer clear of to reduce arthritis pain and inflammation. One of the foods on our list might surprise you. It's something many people eat every day, and it's silently aggravating arthritis. Stay tuned to find out which daily food could be harming your joints and learn practical tips for making healthier choices. Let's dive in. First, we have alcohol. Alcohol consumption can have a significant impact on arthritis, often making the condition worse over time. Arthritis, characterized by inflammation in the joints, is a condition that can already cause pain, stiffness, and swelling. Alcohol, due to its various properties, can exacerbate these symptoms and hinder the management of the disease. Understanding the relationship between alcohol and arthritis is crucial for individuals seeking to manage their condition effectively. One of the main ways alcohol can worsen arthritis is by increasing inflammation in the body. Alcohol consumption triggers the release of pro-inflammatory cytokines, which are molecules that promote inflammation. For people with arthritis, this can lead to more severe joint swelling and discomfort. Chronic inflammation caused by alcohol can also contribute to long-term joint damage, further complicating the disease. Alcohol is also known to dehydrate the body, which can negatively affect joint health. Joints rely on adequate hydration to maintain cartilage function and cushioning. When the body is dehydrated, joint lubrication is reduced, leading to increased friction and wear on the joints. This can make the symptoms of arthritis, such as pain and stiffness, more pronounced. Another factor to consider is alcohol's impact on the immune system. Certain types of arthritis, like rheumatoid arthritis, are autoimmune disorders where the immune system attacks the joints. Alcohol can suppress immune function, making it harder for the body to regulate the autoimmune response. This suppression may lead to more frequent or severe flare-ups, causing increased discomfort and damage to the joints. Alcohol also interferes with the effectiveness of medications commonly used to manage arthritis. Non-steroidal anti-inflammatory drugs, NSAIDs, often prescribed for pain relief, can interact negatively with alcohol, increasing the risk of stomach irritation, ulcers, and bleeding. Additionally, disease-modifying anti-rheumatic drugs, DMARDs, and biologics, which are critical for controlling inflammation in conditions like rheumatoid arthritis, can be less effective when combined with alcohol. Excessive alcohol intake can also contribute to weight gain, another factor that can worsen arthritis. Extra weight places additional stress on the joints, especially the knees, hips, and spine. This added pressure can accelerate joint degeneration and amplify the pain and stiffness associated with arthritis. Managing weight is crucial for arthritis sufferers, and alcohol, with its high calorie content, can hinder these efforts. In people with gout, a form of arthritis caused by uric acid crystal buildup in the joints, alcohol can trigger acute attacks. Alcohol, particularly beer, is high in purines, which the body breaks down into uric acid. This can lead to increased levels of uric acid in the blood, causing sudden and excruciating joint pain. Even moderate alcohol consumption can provoke gout flares in susceptible individuals. Moreover, alcohol consumption can interfere with sleep quality, which is vital for people with arthritis. Poor sleep can exacerbate pain perception and reduce the body's ability to repair damaged tissues. Chronic sleep disturbances linked to alcohol can contribute to overall fatigue, making it harder to cope with arthritis symptoms. Long-term alcohol use can also harm liver function, which plays a role in processing inflammatory mediators and maintaining overall health. A compromised liver can lead to increased systemic inflammation, further aggravating arthritis symptoms. Additionally, poor liver health can make it more challenging for the body to metabolize arthritis medications, increasing the risk of side effects. Next, we have dairy products. Dairy products are often considered a staple in many diets due to their rich calcium and protein content. However, for individuals with arthritis, dairy can potentially have adverse effects. Arthritis, characterized by joint inflammation and pain, may be exacerbated by certain components found in dairy products. One key reason dairy can worsen arthritis symptoms is its potential to cause inflammation. Dairy contains a protein called casein, which some individuals may be sensitive to. This sensitivity can lead to an inflammatory response in the body, aggravating the already inflamed joints of arthritis sufferers. Additionally, lactose, the sugar found in milk, can be problematic for individuals with lactose intolerance. While lactose intolerance primarily affects the digestive system, the resulting inflammation can extend to other parts of the body, including the joints. This can lead to increased arthritis pain and stiffness. Dairy products are also known to produce a significant amount of arachidonic acid, a type of omega-6 fatty acid. While omega-6 fatty acids are essential for health, an excess can promote inflammation. Consuming high amounts of dairy can, therefore, lead to an imbalance, further worsening the inflammation associated with arthritis. Some studies suggest that dairy products can contribute to the development of uric acid in the body, which can lead to gout, a form of arthritis. High levels of uric acid can cause crystal formation in the joints, resulting in intense pain and swelling. For individuals with gout, avoiding dairy products may help in managing their symptoms more effectively. Moreover, full-fat dairy products contain high levels of saturated fats. Saturated fats can increase the body's production of pro-inflammatory compounds. For arthritis patients, consuming these fats can exacerbate joint inflammation and pain, making it crucial to monitor the intake of such foods. The relationship between dairy and the immune system is another factor to consider. Some theories propose that dairy consumption may trigger an autoimmune response in certain individuals. In autoimmune diseases like rheumatoid arthritis, the immune system mistakenly attacks healthy joint tissues, and dairy could potentially intensify this response. Dairy products can also interact with certain medications prescribed for arthritis. For example, calcium supplements derived from dairy can interfere with the absorption of certain medications, reducing their effectiveness. It's essential for arthritis patients to be aware of these interactions to manage their condition effectively. Weight management is a crucial aspect of arthritis care, as excess body weight puts additional strain on the joints. While dairy products can be part of a balanced diet, some types, especially full-fat options, can contribute to weight gain. Increased body weight can worsen arthritis symptoms by adding pressure to weight-bearing joints like the knees and hips. It's also important to note that not all individuals with arthritis will experience negative effects from dairy. Some people may find that dairy does not significantly impact their symptoms. However, for those who do experience worsening symptoms, eliminating or reducing dairy intake may be beneficial. Next, we have fried foods. Fried foods are a common indulgence for many, but for individuals with arthritis, they can pose significant risks. Arthritis, characterized by joint inflammation and pain, can be exacerbated by certain dietary choices, and fried foods are among the culprits. One primary reason fried foods can worsen arthritis is due to their high content of unhealthy fats, particularly trans fats. These fats can trigger inflammation in the body, which can aggravate the already inflamed joints of arthritis sufferers, leading to increased pain and discomfort. Fried foods are also high in advanced glycation end products, AGEs, which are compounds formed when foods are cooked at high temperatures. AGEs can promote inflammation and oxidative stress in the body, both of which can contribute to the worsening of arthritis symptoms. Moreover, fried foods often contain excessive amounts of omega-6 fatty acids. While these fats are essential in moderation, an imbalance with omega-3 fatty acids can lead to increased inflammation. Consuming large amounts of fried foods can, therefore, disrupt this balance and exacerbate arthritis symptoms. The excessive salt content in many fried foods can also be problematic for individuals with arthritis. High salt intake can lead to fluid retention, which can increase swelling and pressure in the joints, intensifying arthritis pain and stiffness. Weight management is crucial for those with arthritis, and fried foods can be detrimental in this regard. These foods are typically high in calories and can contribute to weight gain. Excess body weight places additional strain on the joints, particularly weight-bearing joints like the knees and hips, worsening arthritis symptoms. Additionally, fried foods can impact the body's ability to absorb certain nutrients that are vital for joint health. For example, they can interfere with the absorption of calcium and vitamin D, both of which are essential for maintaining strong bones and healthy joints. A deficiency in these nutrients can further exacerbate arthritis symptoms. The high glycemic index of many fried foods can also affect blood sugar levels. Spikes in blood sugar can lead to inflammation and oxidative stress, both of which can worsen arthritis symptoms. Maintaining stable blood sugar levels is important for managing arthritis, and fried foods can undermine this goal. Fried foods can also negatively affect gut health. A healthy gut microbiome is important for overall inflammation control, and consuming fried foods can disrupt the balance of beneficial bacteria in the gut. This disruption can lead to increased inflammation and worsen arthritis symptoms. For those taking medication for arthritis, fried foods can interfere with the effectiveness of these drugs. Some medications may not work as well when paired with a diet high in unhealthy fats and sugars, making it more challenging to manage arthritis symptoms effectively. Next, we have processed foods. Processed foods, though convenient, can have severe implications for individuals suffering from arthritis. Arthritis, which involves inflammation and pain in the joints, can be significantly worsened by the consumption of these foods due to their various harmful properties. One of the major issues with processed foods is their high content of unhealthy fats, particularly trans fats and saturated fats. These fats are known to trigger inflammation in the body, which can exacerbate the symptoms of arthritis, leading to increased pain and stiffness in the joints. Processed foods are also notorious for containing high levels of sugar and refined carbohydrates. These components can lead to spikes in blood sugar levels, which in turn can promote inflammation and oxidative stress in the body. For individuals with arthritis, this means more joint pain and swelling. Another concern is the presence of artificial additives and preservatives in processed foods. These substances can cause inflammatory reactions in some individuals, further aggravating the symptoms of arthritis. Additionally, certain additives may interfere with the body's natural healing processes, making it more difficult to manage arthritis effectively. Processed foods often have a high sodium content as well. Excessive sodium intake can lead to fluid retention, which can increase the swelling and pressure in the joints. This added stress on the joints can make the pain and stiffness associated with arthritis even more severe. The lack of essential nutrients in processed foods is another factor to consider. These foods are typically low in vitamins and minerals that are crucial for joint health, such as vitamin D, calcium, and magnesium. A deficiency in these nutrients can weaken the bones and joints, making arthritis symptoms worse. Processed foods can also contribute to weight gain, which is a significant concern for individuals with arthritis. Excess body weight puts additional strain on the joints, particularly weight-bearing joints like the knees and hips. This added pressure can lead to increased pain and further deterioration of joint function. The high glycemic index of many processed foods can also negatively impact arthritis. Foods with a high glycemic index cause rapid spikes in blood sugar levels, which can lead to increased inflammation. For people with arthritis, maintaining stable blood sugar levels is important for managing symptoms, and processed foods can disrupt this balance. Gut health is another area where processed foods can have a detrimental effect. A healthy gut microbiome is essential for controlling inflammation in the body. Consuming processed foods can disrupt the balance of beneficial bacteria in the gut, leading to increased inflammation and worsening arthritis symptoms. For those taking medication for arthritis, processed foods can interfere with the effectiveness of these drugs. Some medications may not work as well when paired with a diet high in unhealthy fats, sugars, and additives, making it more challenging to manage arthritis symptoms effectively. Next, we have red meat. Red meat is a common dietary choice for many, but for individuals with arthritis, it can have detrimental effects. Arthritis, characterized by joint inflammation and pain, can be significantly worsened by the consumption of red meat due to its various harmful properties. One of the primary reasons red meat can exacerbate arthritis symptoms is its high content of saturated fats. Saturated fats are known to promote inflammation in the body, which can aggravate the already inflamed joints of arthritis sufferers, leading to increased pain and discomfort. Red meat also contains high levels of advanced glycation end products, AGEs, which are compounds formed when meat is cooked at high temperatures. AGEs can promote inflammation and oxidative stress in the body, both of which can contribute to the worsening of arthritis symptoms. Moreover, red meat is rich in omega-6 fatty acids. While these fats are essential in moderation, an imbalance with omega-3 fatty acids can lead to increased inflammation. Consuming large amounts of red meat can disrupt this balance and exacerbate arthritis symptoms. The presence of heme iron in red meat is another concern. While iron is necessary for health, excessive heme iron intake can promote the production of free radicals in the body. These free radicals can lead to oxidative stress and inflammation, worsening the symptoms of arthritis. Red meat is also associated with an increased risk of developing gout, a form of arthritis caused by high levels of uric acid in the blood. Uric acid can form crystals in the joints, leading to intense pain and swelling. Reducing red meat consumption can help manage gout symptoms more effectively. Weight management is crucial for those with arthritis, and red meat can be detrimental in this regard. Red meat is typically high in calories and can contribute to weight gain. Excess body weight places additional strain on the joints, particularly weight-bearing joints like the knees and hips, worsening arthritis symptoms. Additionally, red meat can impact the body's ability to absorb certain nutrients that are vital for joint health. For example, it can interfere with the absorption of calcium and vitamin D, both of which are essential for maintaining strong bones and healthy joints. A deficiency in these nutrients can further exacerbate arthritis symptoms. The high purine content in red meat can also negatively affect arthritis. Purines are substances found in certain foods that break down into uric acid. High levels of uric acid can lead to inflammation and joint pain, particularly for individuals with gouty arthritis. For those taking medication for arthritis, red meat can interfere with the effectiveness of these drugs. Some medications may not work as well when paired with a diet high in unhealthy fats and purines, making it more challenging to manage arthritis symptoms effectively. Last, we have sugar. Sugar is a common ingredient in many diets, but for individuals with arthritis, it can have harmful effects. Arthritis, characterized by joint inflammation and pain, can be significantly worsened by the consumption of sugar due to its various detrimental properties. One of the primary reasons sugar can exacerbate arthritis symptoms is its inflammatory nature. Consuming high amounts of sugar can lead to an increase in the production of pro-inflammatory cytokines in the body. These cytokines can worsen the inflammation in the joints, leading to increased pain and discomfort for arthritis sufferers. Sugar also contributes to oxidative stress in the body. When sugar is metabolized, it can produce free radicals, which are unstable molecules that can damage cells. This oxidative stress can further inflame the joints and aggravate arthritis symptoms, making it more difficult to manage the condition. Moreover, sugar can lead to weight gain, which is a significant concern for individuals with arthritis. Excess body weight places additional strain on the joints, particularly weight-bearing joints like the knees and hips. This added pressure can lead to increased pain and further deterioration of joint function. High sugar intake can also disrupt the balance of gut bacteria. A healthy gut microbiome is essential for controlling inflammation in the body. Consuming large amounts of sugar can promote the growth of harmful bacteria in the gut, leading to increased inflammation and worsening arthritis symptoms. The consumption of sugar-sweetened beverages is particularly harmful. These drinks can cause rapid spikes in blood sugar levels, which can lead to increased inflammation and oxidative stress. For people with arthritis, maintaining stable blood sugar levels is important for managing symptoms, and sugary beverages can disrupt this balance. Sugar can also interfere with the body's ability to absorb essential nutrients that are vital for joint health. For example, excessive sugar intake can lead to a deficiency in magnesium, a mineral important for bone health and muscle function. A lack of magnesium can exacerbate arthritis symptoms and make it more challenging to manage the condition. Another concern is the potential impact of sugar on the immune system. Chronic consumption of high amounts of sugar can weaken the immune system, making it less effective at fighting off infections and inflammation. This compromised immune response can lead to more frequent and severe flare-ups of arthritis symptoms. For those taking medication for arthritis, sugar can interfere with the effectiveness of these drugs. Some medications may not work as well when paired with a diet high in sugar, making it more challenging to manage arthritis symptoms effectively. It is important for individuals with arthritis to be mindful of their sugar intake and its potential impact on their treatment. Sugar can also lead to the formation of advanced glycation, end products, AGEs, which are compounds formed when sugar molecules attach to proteins or fats. AGEs can promote inflammation and oxidative stress in the body, both of which can worsen arthritis symptoms. Reducing sugar intake can help lower the levels of AGEs and improve joint health.